Urine spraying in cats is a method of marking territory. The cat will typically smell the target area, turn around, and forcibly express urine while standing with its tail upright. The urine is sprayed horizontally onto a vertical object. Another form of urine marking in cats is voiding a small amount of urine while squatting. Cats may also void outside of litter boxes because of factors related to the litter box itself as well as urinary tract diseases. Inappropriate urination is the most common behavioral problem in cats. The incidence of spraying is highest in intact males, but spraying also occurs in intact females, especially during estrus. Even in cats neutered younger than 10 months of age, 10% of males and 5% of females sprayed urine more than once a month. This high incidence of a behavioral problem is related to continuation of a normal feline behavior during indoor confinement with people who obviously find it objectionable. Cats by choice prefer a low population density where each can establish its own territory. They adhere to regular schedules of movement to avoid confrontations with other cats except during breeding season. The frequency of spraying is increased by the sight, odor, and sounds of other cats. Androgens also increase the frequency of spraying while progestogens decrease it. The problem of spraying arises when cats become house pets, particularly when confined with other cats. The incidence of spraying is directly proportional to the number of cats in the household, particularly with male cats. In households of 10 or more cats, a spraying problem is inevitably present in at least one cat. Cats may void urine outside of a litter box because of aversion to the box. Most cats are easily litter trained because of their natural tendency to urinate in a sand or loose dirt. However, cats possess this tendency to varying degrees. Some cats avoid certain types of litter, especially that containing deodorants such as chlorophyll. Dirty litter, litter being used by another cat, and litter in certain types of containers. Cats may also learn to avoid litter boxes if the box is associated with punishment, injury, or pain. Cats may become attracted to an alternate area for voiding urine because of house soiling by another pet or because of discovery of a surface or material that they individually prefer to litter. Environmental changes may also cause a cat begin to urinate outside the litter box. This can induce moving to a new house, redecorating an existing dwelling, adding a new person or pet to the household, or longer than accustomed absences of the owner. Urinary tract problems that cause dysuria or polyuria may also result in urination outside of a litter box. Once cat begins to urinate outside a litter box, it may continue to do so for a reason different from that which initiated the problem. Primary rule-outs for a cat urinating outside the litter box are diseases, urine marking, and urination preference. Under diseases, those that cause dysuria includes feline neurologic syndrome, bacterial cystitis, cystic or urethral calculi, and lower urinary tract neoplasia. Those that cause polyuria includes renal failure, diabetes mellitus, hepatic failure, and hyperthyroidism. Musculoskeletal problem inhibiting mobility under diseases. Urine marking includes spraying and squatting to void small urine volumes without dysuria. Under urination preference, it includes aversion to the litter box, preference for a new material or location, and environmental change. A thorough history is essential. However, owners seldom know what terms such as spraying, incontinence, polyuria, and dysuria mean. The owner should be questioned regarding the presence of dysuria, hematuria, and polyuria, since disease in the urinary tract may cause inappropriate urination. Androgen therapy in cats may induce urine marking. Sometimes, owners of more than one cat do not know which cat is inappropriately urinating. One proposed method to determine the culprit is to inject 0.3 ml of sodium fluorescein subcutaneously or give 0.5 ml orally to the most likely suspect. The urine should fluoresce with a Wood's light for the next 24 hours. Each cat in the household can be checked by evaluating one every other day. A complete physical examination should be performed on the affected cat. Urine collected by cystocentesis should be analyzed. If abnormalities suggestive of urinary tract infection are present, such as pyuria, bacteriuria, and hematuria, a culture of urine collected by cystocentesis is indicated. Survey and contrast radiographs may also be indicated to determine whether calculi or neoplasia is the cause of abnormal urinalysis. If the urine is marginally concentrated, the urine-specific gravity is less than 1.040. Blood urea nitrogen or serum creatinine should also be assessed. A blood chemistry profile and complete blood count may also be indicated to rule out other causes of polyuria. Any medical problem should be treated appropriately. If no medical problems are identified, the problem is one of urine marking or change in urination area preference. If possible, this problem should be differentiated. Small volumes suggest marking and larger volumes suggest change in preference. Neutering is highly effective therapy for urine marking in intact male cats. Immediate improvement is approximately 80% of male cats, and gradual improvement over 2 to 3 months in another 10% has been reported. Behavioral modification can be attempted for both urine marking and urination area preference changes and can be both positive and negative. For both urine marking and urination area preference problems, attention should be paid to the litter box. The box should be cleaned daily. The litter should be completely changed at least once a week. 1 litter box should be provided per cat. For cats that do not respond to the above methods, progesterone therapy is indicated. Approximately 30% of cats will respond to medroxyprogesterone acetate or megestrol acetate. The response rate is better in neutered males than females, and better in cats from single cat households than in-house from multiple cat households, and the best response was in neutered males in single cat households, and the worst in neutered females in multi-cat households. If your cat is peeing everywhere or peeing outside the litter box, working through these 9 steps will help you work out what the cause of peeing everywhere is and work out how to stop your cat spraying everywhere. Number 1. Understand why your cat is spraying. Number 2. Figure out if it is spraying or urination. Spraying is urinating against vertical surfaces, and urinating involves squatting and urinating on horizontal surfaces. Number 3. Make sure no underlying medical problems such as kidney diseases, because this can either cause an increase in urine production or it can make it hard for your cat to use their litter box. Number 4. Make sure they are neutered. Neutered cats have a reduced marking drive. Number 5. Reduce their stress levels. Stress is a huge cause of spraying. Number 6. Litter tray management. Cleaning frequency and litter type. Number 7. Move either tray or food bowl to spot where they repeatedly urinate. Number 8. Proper cleanup. And lastly, avoid these things: negative reinforcement, detergent sprays, and the use of ammonia cleaning products. Working your way through these steps should get your cat using their litter box again or stop them spraying everywhere.